and I am currently working as a clinical development fellow in acute medicine at Kingsmill Hospital, and I will be starting my GP training in the same trust from August 2025. The topic today I have got is MSRA relevance and preparation. As you all know that it is getting a bit tough to secure your first job is in the NHS, so a lot of people are resorting to MSRA as an alternative. So beginning with an introduction of the exam itself, the multi-specialty recruitment assessment, it is basically a computer-based assessment which is used by the UK specialties to assess their candidates regarding their suitability for the training. And this is a list of almost 11 specialties which use MSRA to assess their trainees. Out of these 11, core psychiatry and general practice are the ones that use only MSRA as the sole recruitment assessment tool. So whatever your score is in MSRA will decide whether you get the training or not, while the other specialties, they do have some interviews and other criteria to assess you apart from the MSRA as well. And as far as I'm aware about OBS and gynae, the people with higher MSRA scores go directly into the training. The people with relatively lower scores, they go through the other criteria which they need to fulfill to be able to apply for OBS and gynae. So coming to the eligibility, if you are in UK training program, so anyone who is about to complete their foundation year 2 is eligible to give their MSRA exam. If you are in non-training or you are back in your home country, so you need a CREST form to be signed to be eligible for MSRA exam. The interesting thing for MSRA exam is that you do not need any GMC registration for the exam itself, but definitely for the training and the job, you will need GMC. So technically, you do need GMC registration. There is no exam fee for the exam itself, but for the resources you will need for preparation, you definitely need to pay. As far as the exam dates are concerned, it is usually conducted in 2 different rounds. The first one being in January, February, and the second one usually in September for the leftover seats. As far as the venue is concerned, it is conducted in UK as well as globally in the Pearson assessment centers. So you don't necessarily need to come to the UK for this exam. You can take this at your home country as well. And the entire application process, it is done through the Oriel website. Now, I will briefly discuss the structure of the exam. It is basically based on 2 different components, the first one being professional dilemmas and the second one clinical problem solving paper. The overall duration of the exam is 170 minutes. It is divided as 95 minutes for the PD paper and 75 minutes for the CPS. And God forbid, if anyone has any disability, they can ask for extension in the time. So I will focus more on the professional dilemma paper because this is the place where we IMGs struggle the most. We have, usually most of us have sound clinical background knowledge, but this is the place where we struggle because we are new to NHS. So I would encourage whoever is planning to take MSRA to focus more on the professional dilemma preparation. It is basically a situational judgment test, which is used as an assessment method where they will judge how would you behave in front of any challenging professional situation. And in this, they will cover 3 core competencies: professional integrity, how you cope with the pressure, how empathic you are, and how sensitive you are. In professional integrity, they will see how you will behave with your colleagues, how you will behave with all the nursing staff around you, and how is your behavior with the patients as well. Now, further, it is broken down into 2 different types of questions. There are overall 50 scenarios in the PD paper. Half of them would be ranking questions, and the other half would be multiple choice. The ranking questions, they will give you 4 or 5 independent actions, and you would have to rank them from 1 to 4 or 1 to 5 based on how you feel you will act in a certain professional challenging situation. And there is no absolute right or wrong. There is like no 100% marks in this question. You can like be 80% correct, 60% correct, and there is no absolute wrong as well. And then there will be multiple choice questions where you will be given almost 8 options and you have to select the 3 most appropriate actions. If you select all the 3 which are right, then you get the maximum score. If you get 2 out of 3, then you get few marks, but not the maximum. And the marking is against a predetermined key, and the more marks are awarded as close as your responses to that key. There are no negative markings, so just try to solve all the questions and try to be as close as to that predetermined key. The second component is the CPS paper, which assesses your clinical knowledge and how you make the clinical decision in your everyday practice. It will cover almost 12 clinical areas, which I have enlisted here. It is roughly almost all the specialties of the medical. And then it covers the 5 core domains, which include the investigations, diagnosis, how you manage any emergency condition, prescribing, and your management skills. Again, it is split into 2 halves. Total are 86 questions. Half of them would be roughly EMQs, and the other one will be SPAs. Extending magic questions, they refer to multiple clinical scenarios that are linked to the same set of response options. So you may have 3 or 4 questions with the same response options, and the stem of the question will keep changing. Your answer might stay the same or it may differ. And then the SBAs are the simple multiple choice questions. If you get the right answer out of the 5 or 8 questions, then you get the maximum marks. The same is here, that there is no negative marking, so I would encourage to complete all the questions. Before coming to the resources, I would just briefly discuss the marking. Like, it is not simple. It is comparative as compared to the other colleagues, how they do on that specific day. So there is no maximum achievable score, but keeping in mind that recently the competition has increased. Till last year, people getting a score of around 460 or 480, they were getting the GP training. But this year, anyone below 500 has not got any offer. Having said that, if you prepare well, then you will be able to score more than 500, hopefully. So to discuss the resources for preparation, there are some popular primary resources, which include Past Medicine, Past Test, eMedica, and MCQ Bank. There is no absolute single resource which will guarantee you a good score, but I used Past Medicine and I found it a relatively good source. But again, having said that, you can select any one of them. I have listed the price and the number of questions, so you can judge from that. Secondly, then there are some additional resources like mock questions from Samson clinical courses. Then there is Oxford Handbook for Situational Judgment Test, and there is a PDF 100 dilemma questions. They can also prove helpful in the actual exam. Then coming to the preparation strategy, I would say that at least you should aim for 3 months, but there is no hard and fast rule. People can even prepare in 1 to 2 months. But I would say at least 3 months or even 4 or 6 if possible. Then some general tips in the end. Try to give as much as time as you can to your preparation for the MSRA exam. Familiarize yourself with all the topics I mentioned in the clinical section. Include some timed papers so that you don't run out of the time in your actual exam. And go through the NICE guidelines, GMC Good Medical Practice. They are all available on their website. And then at the end, you can do some tutorials at the Oriel and Pearson website before going to the exam, just to familiarize yourself with the actual exam. And at the end, there is no negative marking, so do answer all the questions. Lastly, if you have any questions, you can ask in the Q&A section, or to give any feedback or queries later on, you can have my email address, and I would be more than happy to answer.